Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Kratom is an herbal supplement that some people take hoping to relieve pain or anxiety, but its safety and legality is a bit ambiguous. For an update, I'm turning to Dr. Willie Eggleston. He's the Assistant Clinical Director of the Upstate New York Poison Center and an Assistant Professor of Emergency Medicine at Upstate. Welcome back to the Informed Patient, Dr. Eggleston.
Thank you for having me back. I'm glad to be here.
When we talked about Kratom a couple years ago, you said the Poison Center received maybe 20, 25 calls per year related to Kratom use. Are you still receiving calls about it?
Yes, so we do continue to receive calls about Kratom use and Kratom withdrawal, or when someone stops the Kratom that they've been using, they have symptoms from the Kratom going away and leaving their body. And those calls have gone up. We've seen a trend where last year we received over 50 calls related to Kratom and patients using Kratom. And this year, we've already surpassed that number, and we're only halfway through the year. So we have seen a trend at our center in our region of growing numbers. And a recent report from the CDC indicates that that trend is being seen across the country. So poison centers outside of New York State are seeing the same numbers, if not higher numbers than we are.
I saw a CDC report that Kratom was found in the systems of more than 5,200 people who died of drug overdoses in the U.S. between 2020 and 2024. Now, this was often in combination with other drugs. Do you know about Kratom deaths in upstate New York?
Kratom deaths are always challenging because, as you just said, there often are other things in their system that are reported. And it makes sense. When folks are using Kratom, some of the common reasons that we hear are to try to self-treat symptoms of opioid withdrawal or opioid addiction. So someone who has, say, fentanyl in their system might have reason to also potentially have Kratom there. So it's hard to say in each individual case what the real cause is or how Kratom contributed, but there certainly are cases where it's pretty convincing that Kratom was likely a primary cause.
Does any federal government agency regulate Kratom?
Kratom is, for the most part, unregulated. The DEA, or Drug Enforcement Agency, does not consider Kratom to be an illegal or a controlled substance like they would for pain medications like oxycodone or they would for fentanyl. It's not regulated by the DEA, and it's also not regulated by the FDA, or the Food and Drug Administration. The Food and Drug Administration considers Kratom to be a new dietary ingredient, but they have made a statement at this point that they have not seen enough information to deem it to be safe enough to be considered a dietary supplement. So what you might consider like a vitamin or herbal product, Kratom is not regulated by the FDA in that way. So it kind of exists in a gray area. No one's really regulating or overseeing Kratom at the federal level right now.
I'm guessing there's no warning label on it either, right?
The only common label that you'll see on it is the disclaimer that it hasn't been FDA reviewed or it's not FDA approved. Aside from that, there's no rules about any sort of disclaimers that need to be on there. Certainly some states have taken it upon themselves to pass state regulations that require some labeling information, but there is no federal requirements around that.
Where can you purchase Kratom?
That's one of the big changes that we've seen that's driven some of these recent rises in cases. Last time we spoke, if you asked me where would you purchase Kratom, most folks would buy it online, at smoke shops, or maybe at specialty stores in their communities. Now we're seeing it more widespread. In addition to smoke shops, it's also at gas stations and convenience stores. So you can go up to the counter in the same place you might buy your energy drink or your candy bar and pick up your Kratom. And so because it's become so broadly available and at places we commonly shop, we have seen a rise in interest and use of the product.
Is there any restriction on age for who can purchase it?
At the federal level, no, but many states have put in place rules and regulations around age requirements. So for example, in New York, this past year, the Assembly and Senate passed a bill that would require ID and no sale to minors under the age of 21. And they also passed some labeling requirements. And those were signed into law by the governor at the end of last year.
How expensive is it?
It really depends. Because it's in so many different formulations now, or different forms, the prices can really vary. Last time we spoke, when folks were using Kratom, most were either brewing a tea or taking it as capsules that contain the powder. Now there are extracts or concentrated forms where instead of it being the plant, folks are actively pulling the chemicals, the active ingredients out of the plant and putting it into new products. So it's now being sold as drinks. It's now become available as things like edibles, similar to what we might see with cannabis products. It's now being sold as dissolvable strips that you take in your mouth. And so there's so many different forms that really the options have broadened, and so the price can really vary. But I have talked with several patients who say they've spent a lot of their money on these products. It's important to remember they do have addictive properties, and folks have gotten to the point where they were spending so much of their daily income on these things that they felt like they needed some help so they could stop using them.
So these varieties, the capsules, the drinks, the edibles, is there a difference in the potency and how these work in the different forms?
There are some big differences and some important ones. Now, again, it's important to stress here, it's not regulated. So we don't know per se from one week to another what the actual concentration is because there's no rules around testing and making sure that the folks who are manufacturing this are labeling it properly and what's in there on the label is actually what's in the product. But the general change that we've seen is especially with these newer products, these concentrates, like these liquid shots and beverages, some of the new tablet products, they contain much higher amounts of what we would consider the active ingredient in the plant. So what you would previously get in a capsule, you might get 10 times that in a tablet, or even more so in some of these beverages. And there's newer semi-synthetic products out there that mimic the effects of kratom that are even stronger.
Do all of these products say kratom on the front of the product, or do you have to go searching through the list of ingredients to find out that it's in there?
Sometimes you need to do some searching. They don't always obviously advertise it. A good example of this is the Feel Free beverage. So this is a beverage that's gained national news attention because a lot of folks have started using it. It contains kratom, and they've developed an addiction and had withdrawal symptoms when they've tried to stop using it. And if you look at the front of the bottle that was being sold, it says it's a herbal botanic, it's a wellness product. The word kratom does not appear anywhere on the front of that label. If you go look in the back and dig through the list of active ingredients, you can find it there. But if you were just looking at the front, it's a plant tonic, it's an herbal product. There's no other information about the specifics.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking about kratom with Dr. Willie Eggleston, a toxicologist from the Upstate New York Poison Center. Compared with prescription medications and opioids and even illegal street drugs that people may turn to for help with chronic pain, kratom is a lot easier to obtain. Let's talk about its risks. You said it does have some addictive qualities. What else could go wrong? What are the other risks?
For all intents and purposes, kratom is an opioid. Now, it's not as strong as something like, say, fentanyl, right? I would consider kratom to be what I would call like a weak opioid, where it can have some of those side effects, like it can make you a little bit sleepy. There is the possibility at high doses, it can slow someone's breathing like other opioids do, but we don't see that as commonly. Now, some of these more potent strains, the one that we've seen out there in the public is 7-hydroxymetragenine, which you may see as 7-OH. This is like a stronger version of kratom, and it is a more strong opioid. And so with that strain or semi-synthetic product in particular, we worry about things like slowed breathing much more. And then there are other effects as well. It's important to remember this is a plant. There's a lot of different compounds in there that can do a lot of different things in your body. So in addition to maybe feeling a little bit sleepy, we can also see increased heart rates. We can see injury to the liver, and in some extreme cases, things like seizures. So it's important to remember that these products are advertised as natural and support well-being, but just because we see those buzzwords on these products doesn't mean that they're safe and safe at all doses.
So are people turning to them because they want a feeling of being high, or do they relieve pain and anxiety?
There's a lot of different reasons. There's actually been a few studies trying to get a better sense of what motivates someone to use kratom, or why would someone make the decision to start using a kratom product. And sometimes it's as simple as I have long-standing pain and I think that this might help. Or I have anxiety, depression, I have an opioid addiction. And because of that, I'm going to use this kratom as a way to try and fix that health problem that I have. But there's also just more general reasons. The most common reason that I hear is just, I don't feel all that great day to day, and this just makes me feel a little bit better. So you do get a whole bunch of different reasons why someone might use it. But it's important to stress that while it's possible that kratom might have a role down the road as a treatment option for some of these diseases, it has not been studied. So we do not know if it's safe. We do not know if it works. We don't know if it does work, at what dose. So there's a lot of unknowns that really I would want to stress to someone who's looking at this as an option to try to treat a longstanding disease like chronic pain or anxiety, that we really don't know if it works and we really don't know how safe it is.
When people run into trouble with kratom, is it because they mixed it with other drugs or alcohol, or maybe they're taking another opioid, or because they took too much kratom all at once? What makes it potentially deadly for somebody?
It can be both. For sure, if someone is mixing kratom with other opioids, like opioid pain medications or fentanyl, you can certainly see increased side effects from the combination of opioid effects. But also, if you're combining with other sedating medications like benzodiazepines or muscle relaxants, that combination can certainly cause more extreme sleepiness or increase that risk for slowed breathing. But we've also seen people get into trouble just by using too much kratom or too much of this new synthetic 7-OH. So too much of it on its own can also be a problem. And then lastly, and one of the more common reasons that we get called actually for kratom is when folks stop using it and they develop withdrawal symptoms, meaning their body has developed a dependence to the kratom. And when it goes away, they have really intense flu-like symptoms, muscle aches and pains, nausea, vomiting, diarrhea. They feel really irritable and anxious, similar to what you might see in a patient with opioid withdrawal. We get folks showing up in the emergency department because they've stopped using kratom and now they have this withdrawal symptoms. And because they never had clear information, they're shocked to learn that they've been using an opioid for months on end and they've developed an addiction.
Are there people who take kratom because they think it's a safer way to get high or relieve pain than a powerful drug like fentanyl?
They're not taking it because they're like, oh, this is going to get me high as a replacement for fentanyl. Anybody who uses fentanyl will tell you that the high you get from fentanyl is absolutely nothing like the high you get from kratom. Fentanyl is way, way more potent. It's a way different experience. So no one's like, I'm going to take this safer thing and this is my new opioid of choice. But what you do hear is folks saying like, I'm concerned about my fentanyl use. I want to stop or I want to decrease my fentanyl use. And so they see kratom as one potential way to try to do that. They talk to friends or they see online that this is a natural substance and it is amazing and it treats opioid use disorder with no side effects. And so that is a pretty common reason why someone might use it, is to try to decrease or stop their fentanyl use. So they're kind of using it almost like a natural Suboxone, but we have no idea if it's actually effective for that.
What does a kratom overdose look like? What are those symptoms?
So a kratom overdose can range from as mild as a little bit of increased heart rate or a little bit of sleepiness to some of the more extremes like slowed breathing, someone in a coma, or even seizures.
And does naloxone help to reverse an overdose from kratom?
Yes, all the evidence that we have up to this point suggests that naloxone works very well to reverse at least the effects of slowed breathing and sleepiness that someone may experience from kratom. Some of the other effects, like seizures, like increased heart rate, someone being really agitated or anxious, naloxone does not work for those effects because they're not related to any sort of opioid action.
What are the long-term effects for someone who uses kratom regularly for a long period of time?
The biggest long-term effect is that substance use disorder or addiction that someone can develop. Just like you can develop an addiction to prescription opioid pain medications, just like you can develop an addiction to fentanyl or heroin, you can also develop an addiction to kratom. And so when folks do develop an addiction, that includes the withdrawal symptoms that are there when they stop the product, but it also includes things like cravings, frequent use. And so for those folks, we often rely on similar treatments that we would use for someone who was addicted to opioid pain medications or to fentanyl. And so medications like methadone or buprenorphine, sometimes called Suboxone, are effective treatment options we can use to help patients to decrease or stop their kratom use.
Well, Dr. Eggleston, this has been very informative. I appreciate you making time to tell us about kratom.
Of course. Thanks for having me back and happy to answer your questions.
My guest has been Dr. Willie Eggleston, the Assistant Clinical Director of the Upstate New York Poison Center and an Assistant Professor of Emergency Medicine at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.